Welcome to Specialist One Day Surgery on Taft Road in Syracuse, New York. Specialist One Day Surgery is conveniently located directly north of Syracuse International Airport, just 3 miles north of I-90 and the I-81 interchange. Specialist One Day Surgery on Taft Road opened in April of 2019. Specialist One Day Surgery originally was located on Intrepid Lane, south of Syracuse, where we have provided surgical and pain solutions for over 17 years. In 2019, all surgical procedures were moved to this new location due to the need for additional space for our growing total joint and spine program. Upon arrival at the surgery center, you will check in at our front desk in the reception area. Here we will confirm your insurance information, collect any copays, and let the clinical team know of your arrival. There is a special TV screen in the waiting room that allows your family member or significant other to know where you are the entire time you are here at the surgery center. As an example, if you are in the surgical suite undergoing surgery, you will see the words "NOR" next to your name. Our front office schedulers and receptionists coordinate all planned surgeries with the SOS offices and your surgeons. They also work directly with the clinical team at the surgery center to manage patient arrivals, changes to the schedule, and preparations for upcoming cases in the following days and weeks. There are 2 bathrooms, 2 TVs, fresh complimentary coffee, and vending machines available. After you have checked in, a member of our clinical team will escort you back to one of our patient pre-op bays. This is the area where we will help you to get prepared for surgery. Our clinical staff, including nurses, anesthesiology, and the surgeon, will all speak with you. After you have seen the nurse, changed, and started your preparations, you may allow a family member or significant other back with you until you are taken to the operating room. If you have elected to receive a regional nerve block after you check in, you will be escorted to a regional block bay. You will be prepared for surgery in the same way someone will if they are in a regular pre-op bay. The only difference is that these regional block bays are equipped with the necessary technology to perform a regional nerve block before you are brought back into the surgical suites. A regional nerve block is used to block the sensation in a specific part of your body during and after surgery. Regional anesthesia is appropriate for a wide variety of procedures, including certain orthopedic surgical procedures that are performed here at the surgery center. Please ask your surgeon or anesthesiologist if you are a candidate for a regional block. Once it is time for your surgery to begin, you will be brought back to the operating room by your circulating nurse, the nurse that's in charge of your operating room, and the anesthesiologist. There are always at least 4 people that will be in your operating room if you are having surgery under anesthesia: the surgeon, the anesthesiologist, the circulating nurse, and the surgical scrub tech. If you need any type of radiology imaging during the case, a radiology tech might also be in the room. Some surgeons also work with a physician's assistant who helps the surgeons with certain parts of the surgical procedure. Specialist One Day Surgery Center is an orthopedic-focused institution. Our over 25 SOS surgeons perform over 700 surgeries per month on average. Whether it's a foot, ankle, knee, hip, shoulder, wrist, hand, or spine, our team has extensive experience. We excel in delivering excellent orthopedic care. Specialist One Day Surgery Center has a state-of-the-art central sterile processing, or CS department for short. The CS department is where we clean, decontaminate, and sterilize all our surgical instruments and equipment. Staffed by 4 experienced New York State licensed sterile processing technicians, we carefully follow strictly regulated national guidelines from all accreditation organizations. After your surgery is complete, your surgical team will escort you to the PACU and recover area. In PACU, the post-operative acute care unit, our skilled nurses will help you wake up, get comfortable, and manage your pain if necessary. Once you are awake and alert, you will be moved to the recovery area, where the clinical recovery team will help you prepare to go home. They will review all the information and discharge instructions that you will need to know in order to successfully navigate your post-operative journey. You will be offered snacks and non-alcoholic beverages. This is where you will be reunited with your family or significant other. Once dressed, you will be helped into your car, which is protected from the elements by a vestibule. We have a full-time physical therapist here on site that will help review all your physical therapy exercises and goals, help answer any questions, and ensure that any sling, brace, or crutch is fitted correctly. Some of our total joint replacement and spine surgery patients will stay with us overnight here at the surgery center. If your surgeon has identified you as a 23-hour overnight candidate, you will be taken back to our 8-room extended care facility. Patients that stay overnight will stay in a private room with a private bathroom. We have a dedicated care team that will stay overnight with you, providing all the necessary care and attention needed until you go home the following morning. One adult is allowed to stay with you overnight in a pull-out bed. Wi-Fi and cable are also available for all guests. Safety is our highest priority. Specialist one-day surgery is accredited by the AAAHC, the Accreditation Association for Ambulatory Healthcare. Founded in 1979, is the leader in ambulatory healthcare accreditation with more than 6,100 organizations accredited. The AAAHC advocates for the provision of high-quality healthcare through the development and adoption of nationally recognized standards. They provide a valuable survey experience founded on a peer-based educational approach to on-site review. The AAAHC Certificate of Accreditation demonstrates an organization's commitment to provide safe, high-quality services to its patients. It is recognized by third-party payers, medical professional associations, liability insurance companies, and state and federal agencies, including the New York State Department of Health.